All right, guys. So today I'm going to be talking about headaches. If you suffer from headaches randomly, or you notice it if you stare at a computer screen for a long period of time, or with prolonged sitting, or if it just seems to be random, it can be kind of frustrating and to understand on what is even causing it and what to even do about it because you don't know what's causing it. And so a lot of times headaches can actually be predictable in a certain sense after doing an assessment to figure out what exactly is going on. Headaches can be, that's the reason for that is because headaches can be caused by a variety of different reasons. A lot of it can be due to hydration status or muscle tightness. And those are the two things that can be controlled. You know, if it's a hydration issue, we just need to drink more water or decrease the consumption of caffeine or decrease the consumption of alcohol or coffee, that because essentially those are a diuretic and they're going to dehydrate us, especially if we're not drinking enough water on top of that as well. So sometimes it can be a hydration issue. If it is, you just need to drink more water. But a lot of times what we see is headaches are most likely caused by tightness in the musculoskeletal system, especially around the base of the skull and the top of the shoulders and the neck area. So if you also notice that your muscles here seem really tight or really achy and are producing pain, and you're also suffering from headaches as well, there's most likely a correlation with it. And the good thing about it is by treating one of those, by treating the tightness here, it's going to make this feel better. It's also going to decrease your headaches as well. Okay. And so you guys like, well, how can tight muscles produce headaches? Good question. So I'm going to share my screen with you guys here real quick so you can see what I'm talking about. So what you can see here is we have the occipital nerves. Okay, these yellow structures here are nerves. Okay, and you can see that they span. Okay, they originate from different areas here. Okay, you can see these are different muscles. Okay, so this is a most superficial muscle. This is your trapezius muscle. Okay, this muscle also spans down and attaches down towards your shoulder, the top of the shoulder. Okay. If we remove this layer here, this is what we see underneath. So you can see there's also a lot of other smaller muscles underneath of it that can be tight. You can see that these nerves dive deep into the muscle. Okay, so if these muscles are really tight, what can happen is it can compress down on these nerves and we get referral pain that turns up as headaches. Okay, or pain surrounding usually it's the side of the head or the back side of the head. Sometimes it can even migrate to the front, but typically we see it along the sides here because these nerves aren't just on the back; they also go to the side of the head as well. So if there's some tightness, yeah, it can compress on those nerves, and we can get referring pain there as well. Okay, so good news is if it is tightness, this muscle tightness, what we need to do is we just need to loosen up these muscles and figure out why are they getting so darn tight in the first place. And a lot of times what it comes back to is the fact that due to poor posture or the ergonomic setup of somebody. Okay, so for example, if a lot of times we're in a pandemic, a lot of people are working from home and they have less than ideal ergonomic setups compared to what they had back when they were going to their actual work site. And so what we're seeing is a lot of people are working from their couch or sitting on their couch, or they're working from in their bed and slouched over, and they're leaned up against the headboard and they're slouched like this. Okay, and or they may be sitting and they're hunched over. And the problem with that is if they're hunched over like this, okay, and if you've got your computer screen up here, what you're getting now is the muscles here are lengthened and the muscles back here are shortened. Okay, so to hold your head up, now all these muscles, the trapezius muscle and those other small muscles that I just showed you guys, have to hold that head up. Okay, so if a muscle has to continuously contract hour after hour, it's going to get overworked and it's going to get tight. And when it gets tight, it starts causing pain, localized pain, and then also if it presses down on a nerve, you can also get radiating pain from that as well. Okay, so versus if we are sitting with good posture, we're sitting up nice and straight. Now the body is being held up by the vertebrae, okay, or the vertebral column, essentially our spine, which is bone. Okay, bone to provide support, Doesn't have to do anything. It's just there. It doesn't have to contract or anything like that. It's just there and provides stability. So if we're stacked, okay, in good posture and in good alignment, now the vertebral columns, the spinal segments are stacked on top of each other. Now they can just sit on top of each other, and your body's getting stability, and your head, it's providing stability for your head, so your muscles don't have to work so hard to hold your head up, okay? Versus again, if we're slouched, okay? For me to hold my head up, now the muscles have to contract to do that, okay? So it's like, well, if I fix my posture, is that going to solve the whole issue? For some it may, but that's the first step. Is you got to figure out what is actually causing it. Is it your ergonomic setup? Is it due to muscle imbalances? What I mean by that is if we have really tight pec muscles, or if like somebody does a lot of push-ups and they don't do a whole lot of back strengthening, what's going to do is it's going to pull your shoulders rounded forward, which is also going to in turn cause you to try and round forward. Okay, so it's not always due to ergonomic setup. It can be due to muscle imbalances where we have a lot of tightness in the front of the shoulders and the weakness in the back. Okay, we got to figure out, is it the muscle imbalance? Is it the ergonomics? What came first, the chicken or egg? Are you sitting with poor posture because you have muscle imbalances? Or do you have muscle imbalances because you're poor posture? Or is it a combination of the two? And on top of that, there can be a lot of different tissues that are tight and imbalanced, okay? So doing an assessment is the best way to figure out and narrow down what is actually causing the problem, okay? Because a lot of times what people do is they'll get massages, and they'll do some neck stretches, stuff like that, but they're not correcting they're kind of being reactive and treating the symptoms of what's causing the pain, but they're not treating the root issue of what's causing the symptoms, which is leading to the pain. Hopefully that makes sense. So you got to figure out what the root issue is. So for example, like I said, a lot of times people do stretching because they have a lot of this muscle, or do a lot of massage or soft tissue work on this area to loosen up. So they feel good for like 2 or 3 days, and then a couple days later, it's back. And the reason for that is because they're just going after the symptoms. They didn't treat the root issue. Okay, so like the root issue could be the way that they're working out. They're doing too much pressing. Could be that they're not doing enough back strengthening back strengthening exercises, or it could be their workout, it could be their work setup or ergonomic setup. It could be stress. It could be the way that they're breathing. So for example, we're supposed to be breathing through our diaphragm. And so that should be coming from the abdominal cavity. But when we're stressed, we subconsciously will start breathing through our chest. You guys might notice that when you're stressed, you might feel like you're breathing like this. I'm exaggerating it. Okay, it's probably not this bad. Some people it is. Okay, but even just micro movements of this, taking breaths day in and day out like this, what's producing that movement is your upper trap muscle. Okay, so for example, somebody came in and saw me, and they're really stressed. They were going through a lot, and they fought through. They went before they came back in to see me. They were a previous patient that came in for knee pain, but they messaged me and they're like, "Hey, it's been about a month. I've been dealing with this horrible shoulder pain, and I just can't figure it out. I've gone on YouTube. I've done a lot of exercises that are claimed to be the best exercises for shoulder pain, and nothing seems to be making a difference." So she came in and we did an assessment. And when I was talking to her, I noticed that her neck muscles were really tense. She was breathing like this. I could tell she was stressed out. I knew she was stressed out. And so in turn, I started looking at her breathing patterns. And so during that assessment and that treatment, I did a little bit of hands-on work, not a whole lot, but most of the session was actually just based on her breathing and working on her breathing techniques and different meditation techniques for her to do before she went to bed, because she was having a hard time sleeping because she was in so much discomfort. And she texted me 2 days later and she's like, "Hey, this is the first night that I slept throughout the entire night. I did the breathing exercises and it did wonders." Okay, so a lot of times it can be things that you're not even thinking about that are actually causing it. Okay, a lot of people don't correlate that breathing improperly is going to lead to neck tightness, which is in turn going to lead to headaches, because she was suffering from a lot of headaches as well. Okay, so you guys can see there's a lot of different moving pieces, and without knowing what to look for, it's easy to miss. Okay, and a lot of times she told me, she's like, "Oh my gosh, this is really simple, and I wish I wouldn't wasted so much time trying to figure out on my own by searching best YouTube exercise," because YouTube hasn't done an assessment, to figure out what the root cause of it. There is no best exercise for shoulder pain, because or neck tightness or headaches, because it's everybody's root issue can be different, can be a total, so many different reasons of what's going on as well. Okay, so get to the root issue of what's going on. Hopefully this makes sense, guys, of what can be causing the headaches as well, and whatnot too. So if you guys have questions, just let me know. I'm happy to help. All right, thanks, guys.